Dr. Seema Kumari, is she there? So, Dr. Seema Kumari will be talking about a study to assess ocular findings in beta thalassemia major in pediatric population in East Singbam.
A very good morning to one and all. I'll be presenting a study to assess the ocular findings in beta thalassemia major in pediatric population in East Singbam. I have no financial interests. Globally, 19 million children are visually impaired, and an early screening is recommended for ocular complications for systemic diseases like thalassemia, very similar to ROP, as the prevalence of ocular findings in thalassemia ranges from 41 to 85%. So if you look at the ocular manifestations of thalassemia, it's almost 10% as a major cause in childhood visual impairment. And globally, as our Jharkhand is an endemic zone for this disease, where the prevalence of beta thalassemia in tribals in Jharkhand is about 7%, because this disease actually manifests early in the first 2 years of life, and a lot of clinical and psychological problems are associated, and both iron overload and iron chelation therapy, they both contribute to the ocular manifestation. The American Academy of Pediatrics has recommended an annual ophthalmic examination for children with thalassemia, starting from the diagnosis. Therefore, in order to avoid the progression to irreversible loss, we need to implement a multidisciplinary approach for this disease, collaborating the pediatrician, hematologists, and the ophthalmologist. So why the study? Now, as you know, the government has come up with a screening program for thalassemia, but it is optional, and therefore, this type of study can provide a national guideline for mandatory ophthalmic examination in thalassemia, and it also helps in understanding the clinical and psychological problems associated with thalassemia. So the aim of the study was primary objective was to identify and describe the ocular manifestations and their severity associated with thalassemia, and the secondary objective was to identify factors associated, socio-demographic factors, use of iron chelating agents, and number of transfusions for the ocular complications. So this was a hospital-based cross-sectional study, which was done on 84 children, 1 to 13 years, and a consecutive sampling was done for 200 registered cases in the Department of Pediatrics, MGM Medical College and Hospital, Jamshedpur. So all children of age 1 to 13 years who were diagnosed with beta thalassemia and whose parents gave consent, they were included, and children with other hemoglobinopathies and other congenital acquired comorbidity, they were excluded from the study. And a comprehensive ocular examination was done. Serum ferritin was measured. Uncorrected and best-corrected visual acuity was done, and TBT was done to measure the dry eyes. This was these were the socio-demographic factors. The results, all the thalassemic patients, they were not asymptomatic, that they had various complaints like decreased vision, blurry vision, eye pain, discomfort, and other difficulties with night vision. In the visual acuity, it was decreased in 19% of patients, and ocular surface instability with dry eye disease and MGD was present in 38.1% of cases. In the slit lamp findings, we had conjunctival pallor unknown associated with corneal arcus or iris hyperplasia. Some cases of VKC with pallor were seen, and slit lamp abnormality was present in almost 88.1% of cases. Fundus changes, we had angioid streaks, optic disc pallor, RP changes, some cases of CNVM. And the compliance to chelation therapy was correlated with the visual acuity and ocular surface instability, and none of the correlations were significant, statistically significant. The compliance to the correlation of serum ferritin with current chelation therapy was seen, and it was statistically significant. So in our study, we did not find any significant correlation between the ocular abnormality and serum ferritin levels. We did find a correlation, we did not find any positive correlation between RP changes and the serum ferritin levels. This was similar to the studies done by Jaffrey et al., where no statistical significant correlation was seen between the ocular abnormalities and serum ferritin levels. However, the number of blood transfusions were positively correlated with the serum ferritin. Similar studies like Rashid et al. Here also, children aged 12 to 17 years, where ocular manifestations of about 22.7 were seen. Here, male gender was a risk factor. The limitation of our study was it was a small sample size, and the diversity of patients require characteristics such as age and physical conditions or differences in the beta thalassemia treatment protocol in the past they may confound some degree of results. Long-term RCTs are required for further. And to conclude, recommendations, the study recommends ophthalmic screening to be integrated with the routine thalassemia follow-ups. Ocular changes are more common in thalassemia major, often asymptomatic until advanced stages. Screening and monitoring can prevent permanent vision impairment, and a multidisciplinary approach enhances outcome, ensuring both systemic and ocular health as addressed. Our study can propose evidence-based screening intervals, annual dilated examination. Thank you.
Thank you. I think thalassemia is more common in Punjab. You found so many cases there. I think that's a bit.
Sir, I am from Jharkhand, sir. And Jharkhand is an endemic zone for this disease.
Thalassemia.
Yes, sir.
Otherwise, you have studied in a very diverse way. There should have been some parameters which are specific to thalassemia. That probably would have been more specific and to the point. You have been very diffusely.
Sir,
you have studied so many things. I think. So
actually, sir, in our state, there has been no study in this concept regarding the ocular manifestations. And because the patients, they are directly coming in the pediatric department, they are not being referred to there. We were actually trying to make a regular protocol, a mandatory protocol for ophthalmic examination. Whenever the patient is coming to the pediatric department, they have to come to ophthal and then get the patient checked.
But we should be able to establish cause and effect relationship. They may just be having thalassemia, and the reason for say dry eye may be entirely different. So that cause and effect relationship.
Yes, for the studies, actually, we will be instituting.
I think we need to study more in a more specific way.
Yes, sir.
So, doctor, what are the limitations of your study?
So, first of all, ma'am, it was a very small, sample size was quite small, and we had methodology limitations also because we don't have an OCT at an institute. So that was one, and a lot of OCT and other MRI T2 need to be studied because iron overload that has to be excluded because chelation therapy in itself can also pose a lot of ocular toxicity. So the study was not able to differentiate between all those specific points. So further studies are required. I'll be doing that in future. Thank you so much.